Hi, my name is Edwin.
Hi, how are you?
I'm well. And what is your name?
Mackenzie.
Mackenzie, nice to meet you.
Nice to meet you.
Mackenzie, what is your date of birth?
June 16, 1978.
June 16, 1978. Thank you. And do you know what day today is?
Yesterday is Wednesday, October 8th, 2014.
And you know what time it is?
Yes, it's 5:30 p.m.
5:30 p.m. That's right. What I'm going to do today, Mackenzie, is do what they call a head-to-toe assessment. We're just going to proceed in a head-to-toe fashion. That way, it's very comfortable for you, and we can get this done very quickly. Mackenzie, while I'm standing up here, I'm going to go ahead and take a very quick look at your head. I have to make sure that it is symmetrical. There aren't any depressions, which there aren't. And your scalp, the color is very uniform. Your hair is very smooth, and there aren't any asymmetries in your head. It's midline. It's proportionate to your body. Now, Mackenzie, I'm going to go ahead and take a quick look into your ears. Okay? Sorry, I'm grabbing my instrument here. And I'm just going to turn around right here. Your trach is here, and I'm just going to pull your pinnae back here so that I can look into the ear canal here. Now, normally inside of the ear, you would see the tympanic membrane, and that itself should be a pearly gray color. I'm going to do the same on the other side. And again, your tragus here, your pinnae here, and we're going to look inside there. And again, no excessive cerumen inside, no discharge. We do have fine hairs, which aids in hearing. And your tympanic membrane on this side should also be a pearly gray color. And I'm going to palpate here for any tenderness, for any swelling, and both ears are symmetrical to the head. I'm going to feel for your temporal arteries here. Okay. Alrighty. And while we're here at your ear, we're going to go ahead and just palpate your lymph nodes. This is your preocular, postauricular here, and then tonsillar, submandibular, submantle, interior cervical, posterior cervical, and supraclavicular, which will be about right here. Now, we're going to look here at your eyes. We see that your eyebrows here are symmetrical to your face. And while I'm doing this here, I'm going to go ahead and pull, and I'm going to pull at your eyelashes here. They're even bilaterally. And I am going to look at what they call your palpebral features here, just to look to see for any redness, discharge, or swelling. Same right here. I'm also going to look at the sclera, your conjunctiva. Need to look at that. And it's a nice pink color. There's moisture, so there's no excessive discharge. There's no lesions or any sign of infection. I'm also going to go ahead here and check out the sinuses for tenderness. Do you feel any tenderness? No pain?
No.
Alrighty. And then now I'm going to check your nose. It's midline. There's no septal deviations. It's a nice and pink color on the inside. Now, before we move along, I'm going to go ahead and check for what they call cranial nerve number 5. And what I need for you to do is to basically clench your jaws, and then And I'm just gonna check to see. Okay, go ahead. Do it again. All right. All righty, thank you. Now I need for you to just close your eyes for me for a minute. And I'm gonna touch your forehead, your cheeks, your nose, and your chin, and you're just gonna tell me whether you feel it, okay?
Yeah.
All right. Perfect. Thank you. Now, I also need for you to smile for me. We're checking cranial nerve number 7. Smile. Okay, frown. 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 Like you're a mean guy. All right. Raise your eyebrows for me. All right. And I need for you to puff your cheeks again. And puff your lips like you're going to kiss me. All righty. Thank you. Now, I want you to open your mouth. And I'm just going to take a quick look here at your gums. They're nice and pink. Your buccal mucosa also is very nice and pink. Your lips, there are no cracks, no dryness. Your soft palate is nice and pink. Let's check the upper part. And your gums are nice and healthy, no signs of gingivitis, no discharge, or any kind of infection. I am going to grab my little instrument here. And I am going to have you open your mouth. And I am going to have you stick out your tongue. Stick out your tongue and say, ah. All right, and that uvula did rise, and it's symmetrical. All right. Thank you very much. And now let's go back up to your eyes for a minute. I need for you to look straight ahead. And then I'm just going to flash this. And then, so your pupils are equal, round, and reactive to light, and accommodation. And I'm going to go ahead and point this again, and I need for you to look at the light and just follow it with your eyes as it comes close to you. Follow it as it comes close. And do it again. Great. Thank you very much. Now, we're going to use these little cards here that I have made, and you're going to tell me what it is exactly that you see. What letter, what number is it?
6.
All right. And this one?
7.
And this one?
3.
And this one?
9.
All righty. And then now cover your eyes for me. Or you can use this to cover your eyes. Okay, you want to do that. And then look at this object as it comes close to your face. And remove the cover. Okay. All right. Now, we checked for what they call convergence, accommodations. So, and we also checked for gross visual acuity. Now, look straight ahead, and I'm going to do this. What do you see my finger doing? Try God D. What do you see my finger doing? And do you see it right here? Thank you. And now I'm going to put these little gadgets over here. Just a minute. All right. And we've already checked your nose. We've inspected your throat. Now what I'm going to do is check for what they call your thyroid. And I'm also going to have you do a little bit of swallowing for me, okay? All right. All right. So, we're right here. And go ahead and swallow for me. All righty. Do it again. Okay. Now, there's no tenderness here. There's no sign of any goiter. And there's no swelling. So, your thyroid is normal for its size. I'm going to go ahead and palpate here for your carotid arteries. And we don't want to palpate both of those at the same time because we don't want to cut off any blood supply to the brain there. All Now, I am going to listen to that carotid artery, okay? Alright. Just look ahead for me. Look straight ahead. Oh, sorry. Alright. And I also want to make sure that the trachea, it is midline to your neck. And what I need for you to do, I'm going to have you do a little bit of neck exercise for me. I need you to flex your neck going forward. Come on. Flex your neck going forward. Flex your neck going forward. And then extend your neck. Hyper extend your neck. Now I need for you to do what they call lateral flexion. Okay? Back again this way. And I need you to do rotation for me. Alright, thank you. Got a little bit of cotton there on your beard. Stuck on your beard. Okay. I need for you to lay down this way for me. Okay. And what I'm going to do here is check for what they call jugular venous pulsation. And I need for you to turn your head over to the left for me. And I'm going to have this tandem light flashing over here. Oh, let's see. Come here. Okay. As we can see, this here is your carotid artery, and this here is your jugular venous pulsation here, right about there. All right, go ahead and sit right up for me, please. Now, go ahead and stand up. I need for you to go ahead and try to shrug your shoulders for me. All right, bring it back down. And try to go against. All right. Perfect. All right. What I'm going to do is listen to sounds at the back here. Again, I'm looking at your skin back here, and the texture is soft. There's it's moisture, so it's not dry, no flaky, scaly skin's coming off. Good skin turgor. If I'm pinching you, I'm just making sure that your skin is able to bounce back to its original shape without any tinting. I'm going to go ahead and check for even breathing. Your spine here is midline, and there's no signs of deformities or any malformations there. I'm going to go ahead and listen to your breath sounds while I'm here. Go ahead and breathe for me. Thank you. All right. Okay. Again. Again, it went from a resonant sound, which is normal breath sounds, to a more like a dull sound. Oh, one more thing. Go ahead and say 99 for me.
99.
Say it again.
99.
Say E.
E,
Say A.
A,
And now whisper something for me.
bye bye,
Whisper it.
bye bye,
Not to me. Whisper it.
bye bye.
All right. Thank you. All right. Now, while I'm listening, I might as well just go ahead and continue to listen. I need for you to raise your shirt. And I'm just going to go ahead and listen to your interior chest. Read for me. All right, and then what I'm gonna do while I'm here is listen to what they call your aortic valve, your pulmonic valve, your Erb's point, your mitral valve, your tricuspid valve, and your mitral valve, okay? Okay. You can just breathe normal. Sorry. Okay, your aortic valve is second intercostal space to your right, very close to the sternal border. And then you'll hear the aortic valve right there. And on your pulmonic valve is also second intercostal space, except it's on the left sternal border. That's where you would hear your pulmonic valve better. And your Erb's point is third intercostal space, left sternal border. And your tricuspid valve is your fourth intercostal space, right in between the mid-clavicular line and halfway there between your left sternal border. And your mitral valve, you'll hear it more over here in the fifth intercostal space, and that is right there on the mid-clavicular line. Okay, now I'm going to go ahead here and have you lay down for me again. I need to listen to your, go ahead and listen, okay. Your PMI, go ahead and keep your legs straight, which is what they call your point of maximal impulse. And I'm going to have to listen to that for a whole minute. Okay, so we got a rate of 84 beats per minute. We hear clear S1 and S2 with no murmurs or any suspicious hard sounds such as S3 and S4. While I am here in the abdomen listening, in the chest area listening, I'm going to go ahead and just listen to just the abdomen for bowel sounds. You want to go ahead and listen first before you palpate. Again, while I am listening, I'm also looking at the skin, inspecting the skin, making sure that there are no bruises, no lesions, no scars. The skin is not too dry or flaky. That there are active bowel sounds here in the right upper quadrant, where your liver would be in that right upper quadrant here. And then your left upper quadrant there. And then your left lower quadrant there also. And as I have heard, there are active vowel sounds. Before I do that, let me go ahead and listen for the abdominal aorta. Here. And there are no bruits or heaves or any lifts. I'm not feeling any thrills. And I'm going to go ahead and palpate the abdomen here for any tenderness, any masses, and then the liver too for any rebound tenderness, and you don't feel any tenderness in the abdomen. I'm going to go ahead and percuss. Should be more of a timpani sound. As we move over the liver, we might hear a bit dullness, but the stomach, abdomen area should be more of a timpani sound. I'm going to go ahead here and press against the costovertebral angle here for tenderness. Also, shouldn't feel for this. You shouldn't feel the spleen, which I don't. And go ahead and skin here is moist, no dryness. Color is even, hair is even on the skin here. There aren't any lesions or scars of any nature. Just sit up for me. I'm going to go ahead here and also listen, just palpate here the costovertebral angle at the back. Let me go ahead and have you go ahead and stand up for me. I think this will be a little bit more comfortable for the both of us. Drop my pen for the both of us here. I need to see your hand. And I'm checking here your joints, no swelling, no tenderness, no edema. Both here, swelling, tenderness, none of that present, no edema. I'm checking for cap refills. And they're good. Less than 2 to 3 seconds. Both hands. And the nails here, they have a really nice curve, no clubbing or cyanosis. Let me look at your palm. All right, now I want you to go ahead and grip my hands for me and squeeze. All right, good grip, good grip strength, 5 out of 5. Now I'm going to go ahead and apply pressure. I want you to push up against it. Good. All righty. Now I need for you to pull for me. I'm going to go ahead and give. Thank you. All right, thank you. Push back on it. All right, great. Now I need for you to go ahead and flex your wrist. Extend it, hyperextend, and go ahead and do an ulnar and radial deviation for me. All righty, this is your radial. That will be an ulnar. Also do the same things with your finger. Flex, extend, and hyperextend for me. Alrighty. Now with your fingers, I need for you to do what they call adduct. Alright, abduct. And with your wrist, you've already flexed it, and we've already done the ulnar and radial flexion. Now I need for you to do the same thing with your elbow. I'm going to ask you to flex your elbow. Okay, extend your elbow. Okay, no tenderness here, no masses here, no swelling, no edema. And I need for you to hyperextend it. Alrighty, thank you. We're going to do it over here. Flex it, extend, hyperextend, thank you. And now we're going to do your shoulders. I need for you to basically push up against my hand. Alright, great. Now, I need for you to have your arms here at your side. And I need for you to, this is adduction, this is abduction. And I'm going to ask for you to do what they call circumduction. Okay? Alright. And here we see that there's no deformity in the shoulder and that they're even, they're symmetrical to the body. So that is perfect. While you're standing up, I'm going to go ahead and check your spine. Won't you go ahead and like lean over for me? Just lean over and touch your toes. And I'm just checking here to see if it's midline. There aren't any tenderness. There's no pain. There's no sign of any deformity like scoliosis or anything of that nature. Now, while you're standing up, let's go ahead and do your hips here real quick. So we're going to stand again with our hands right near our sides. And we're going to do, let's start with the right leg. We're going to abduct, take the leg away from the body, and we're going to go ahead and do what they call adduct. You're going to do inversion. You bring your hip this way. No, you stand straight. And then eversion. Alrighty. And then you're going to do circumduction. Great. We're going to do the same exercise with your other leg. Abduction. Adduction. Inversion. Eversion. Alright. And circumduction. Great. Now, I'm going to go ahead and have you, I'm going to just go ahead and check your pelvic area here. Can you flex your spine laterally for me? Thank you. Do it the other way. And can you do a circumduction? Just bring it around town. SpongeBob. Bring it around town. Great. That was perfect. Now we can have you go ahead and sit back down. Except this time we're going to move your head this way. And we'll have you go ahead and lay down this way. And since we are not, we don't have a lab, I'm going to go ahead and use this nice Louisville Slugger bat. I'm not going to hurt my patient. I just want to check the reflexes in his knees, which are your patellar reflexes. So here we go. Just a gentle, just a gentle hit here, right below the kneecap, and we'll do it again over here, and then do it over here, and this one you have a mild one. All right, and we're gonna go ahead and do what they call the Achilles one, which is back here, and we'll also do it back here. I'm gonna do also the Babinski reflex, and this up here, and we're We're going to start here at the outer aspects of the soles of the foot, and we're going to scratch. Alrighty, and he's doing the no with his foot there. And we're going to do both to make sure that it is that bilateral. Okay, it is bilateral. All right. Also, while you're, go ahead and sit up for me. All right. Let me go ahead and check your brachioradialis. I'm going to use this instrument here, and you should see a little reflex here, not much, but a little reflex here in the muscle. All right. Same for here. See if we do it right here. All right, got it right about here. Had a little bit more response right here, but it's still responsive right here. And we're gonna check this one over here, and you see it right along the thumb here. And same thing should happen. See, and felt it right here. Also, we're gonna go ahead and do it here. Yeah, felt it right about here. And that's your triceps, by the way. And we will do it right about here. And go ahead and lay right back down for me. I'm gonna need to, for you to just to check the pulses in your, okay, pedal pulses, this is what they call the dorsalis pedis pulse. Here. So they're present, and really hard to check your posterior tibialis, posterior tibial, right about here. And they're present. And should be able to feel another set of pulse, the tibial pulses, popliteal. I meant to check for your pulses right here. That's your radial pulse. Brachial pulse. We'll also check for them right here. Oh, okay. Now, I need for you to flex your knees for me. Okay. Extend your knees. Hyperextend your knees. Okay. Flex this one. Extend it and hyper, and then I need for you to dorsiflex, dorsiflex, that one also, and plantar flex for me. Alrighty, now I want you to push up against my hand, just push up like you're trying to get my hand off. Great. Now push down. Alright, great. Now, since we did not examine genitalia in this video, Normally, the male genitalia would have urethra that runs along the penile shaft. You'll have the scrotum. It should be round and smooth. Both testicles descended. You should not have any crusting or foul odor or any discharges there or any sign of sexually transmitted diseases. The rectal area, there should be some hair in there, and there should not be any signs of any hemorrhoids or any signs of infection or crusting or break in the skin integrity. You can go ahead and sit down and put your socks on, and I'm going to go ahead and perform some hand hygiene. Do you have any questions for me?
No.
No. All right, well, this concludes our physical assessment, and I hope you enjoy it. Thank you very much.
Thank you very much.